It is my privilege and honor today to deliver the 2023 Jacob Chandy Oration. I am grateful to the CMAI and particularly to Dr. Divya John for having asked me to do this. The topic that I have chosen is the relevance of the Christian mission in India in 2023. And I think that this is something that the CMI needs to think about as we look at our role and our vision for what we are going to do as a Christian mission in India. My own association with Dr. Jacob Chandy was when I joined CMC in 1967 as a medical student, and Dr. Chandy was the principal. And it was his voice which announced the results, number 7, number 12, number 22. And your heart sank when it came to 23, and you were 23 and wondered whether you were in. But I did get in. And Dr. Chandy was the principal. He left CMC and I continued on. And many years later, when I was the head of the hematology department, I got a note from the medical superintendent saying, Dr. Chandy wants to see you. I wondered what it was. I went to the office and there was Dr. Chandy. And he looked at me and he said, what is all this about hematology? You have to think big, big, really big. And I want you to think of an institute of blood diseases, which will be the best in CMC, in India, and possibly the world. So that was his vision for what CMC should be. And I believe that it is said that he remarked that if there is anything, any technology, any advancement in medicine that is there in any part of the world, at some time, CMC should have it. So such was the greatness of the man whom I am honoring today in this oration. Now, as we look at the vision of what Christians should do in the healing ministry, one wonders when you look at the volume that is available in the country, whether we have a relevance. There are 700 medical schools which produce more than 1 lakh of doctors every year. The government sector has 24,000 primary health centers and 157,000 sub-centers. So is there a role for us as Christians in the healing ministry? Now, if you look at this data, it shows that surely there is. And this is NHWA and NSSO data on the gap in the availability of healthcare workers in this country with a projection of 2022. And you can see here that the shortfall for projected numbers in 2030 is more than 1 million health workers who are required. So there is, particularly in the realm of manpower, but I would say much more than that. This is the data on the census of India 2011, which shows that Christians make up only 2.3% of the total population of this country. So if we ask, what can 2.3% do in a population of 130 billion? If we remind ourselves of what is said in Matthew verses 13 to 16, "Ye are the salt of the earth, but if the salt has lost its savour, wherewith shall it be salted? It is henceforth good for nothing, but to be cast out and to be trodden under the foot of men. Ye are the light of the world. A city that is set on a hill cannot be hid, neither do men light a candle and put it under a bushel, But a candlestick giveth light to all in the house. You are the light of the world. Let your light be seen, so that your good works will glorify God. So our mandate is very clear. This is a picture of St. Peter at the Golden Gate. And in Matthew 10 verse 8 it says, heal the sick, cleanse the lepers, raise the dead, cast out devils. Freely ye have received, freely give. So our mandate to heal is from our Master himself. Now if you look at healthcare in India as an industry, it's valued at $372 billion in 2022. I'm not going to go through these stats, but even the e-healthcare market is estimated as 10.6 billion by 2025. So there's a lot of money to be made in healthcare. Now this is an article in the International Journal of Health Policy and Management. And it says there is an erosion of trust in the medical profession in India and time for doctors to act. Doctors across the country have been exposed and indicted on counts of corruption, professional negligence, taking kickbacks, and illegal dual practice, both in the court and in society at large. So we need to produce a paradigm shift in the way healthcare is delivered and charged for in this country. So I believe that the question is answered, that there is a need for the Christian ministry in India. This is the outpatient on a busy weekday in CMC Vellore, and you can see that the numbers are staggering. Another view of the same. So why do so many people still come to Christian institutions for their healthcare needs when there are any number of private hospitals, where there is the government sector which provides low-cost care? Why do they still flock in large numbers to our institutions? This is the new campus in Ranipet, and you can see that already the crowds there have increased to a huge level. So I believe that the reason why Christian institutions still attract a large number of patients is 1, trust, 2, competence, and 3, compassion. People still believe that if you come to a Christian institution, you will not be operated if you don't need the surgery. You will not receive a treatment just because the doctor or the institution is going to get a cut out of the cost. Secondly, competence. And I believe that that is the core. They will not continue to trust if you are no longer competent and delivering the highest quality of care with the available resources. And that mandate is not there in the corporate sector. Thirdly, compassion. And I believe that this will be the trump card. If trust and competence are there, then the patient comes because he would like care with compassion. And these are the reasons why I believe that Christian institutions have a place in the India of 2023. Firstly, I would like to look at our training institutions, our medical schools. Secondly, our tertiary level hospitals, secondary level hospitals, and community-based care. All these 3 are relevant in the India of 2023. Firstly, considering our medical schools and our training institutions. When I was in Odanchatram, we had 2 doctors who had come from Kerala, from the medical college system. We had a patient in the ICU who was hypotensive, BP unrecordable. He had come in with diarrhea and vomiting. Now, both the doctors wrote up a fluid order and were leaving the ICU. I was there and I thought, my God, something's wrong here. My training in CMC would have told me that you cannot leave till his blood pressure comes back and he is stabilized. So it was not that they were not concerned or caring. It was just that the training didn't tell them I have seen my professor of surgery 2 o'clock in the night being with a patient when we had ICUs which were only in the ward and not special ICUs. So are we providing institutions where the concept of care goes beyond the basic? This is something that we must ask ourselves, and whether we are teaching compassion. Now, compassion cannot be taught. It has to be learnt from individuals who are practicing it and where the student sees it. We cannot be hypocritical about this. I also believe that excellence must be the underlying motive in our training institutions, and they should be the best in the country. Now, if you look at what motivates a medical student to take up medicine, there are 3 factors over there. 1 is science, 2 is society, and 3 is humanitarian. And it's interesting that in high-income countries, you can see that, in fact, all 3 are pretty close in terms of why a doctor chooses to go, a student chooses to take up medicine. We must maintain these 3 components as we take them through their medical education. This is the Christian Medical College, and I believe its success is because of what I have quoted here. The success of a great institution depends on how many people who live and work in it have imbibed its spirit, its legends, and its history, and therefore make a commitment that is beyond themselves. If 20% of our students do not consider that continuing in CMC or in a Christian medical institution would be a satisfying thing for their lives, then we may lose the boat. So we must aim to see that the legends of these institutions are communicated, imbibed, and become the basis on which that individual lives and works. This is Gwenda Lewis. She was professor of anesthesia at CMC Vellore, and one day I was called by Dr. Koshi to take her from the director's house to take her to see Dr. Koshi. I came to the big bungalow, and here was this lady on a wheelchair, and I had a Maruti 800. So taking her and putting her and the wheelchair into the Maruti 800 was a task. But this lady was paraplegic, and on her face I could see the joy of life, which meant that despite becoming a paraplegic, after giving mouth-to-mouth anesthesia for a patient who had arrested, this lady was still continuing to live life in all its fullness. And that legend was something I will never ever forget. Compassion is something we must communicate, and the science of compassion being an essential component of medical training and medical work is something that the Christian institutions must emphasize throughout the career of a student. The COVID crisis showed us that the health industry in India could rise up to the occasion and provide compassionate care at considerable risk to their own lives. And I believe the Christian institutions played their part in no small measure for this. So I believe that we should teach communication, because communication is the vehicle of compassion. How often do we teach doctors to respect all members of the healthcare team and to consider nurses, technicians, housekeeping, all as equally important in our healthcare mission? And I believe that there are 2 words which they must know. One is sorry and the other is thank you. And these are the oil of human relationships, which makes the engine move smoothly. Now, when I finished in CMC, I was asked by Dr. Dinshaw to join the Tata Medical Center in Kolkata. I kept saying no. Finally, she said, come and meet Mr. Krishna Kumar in Bombay. So I went there, and here was this honcho of the industry who had turned around Tata Tea into a massive international empire. He looks at me and says, talks to me for about 15 minutes about religion. And then I said, sir, I'm willing to join as a hematologist, but not as the director of TMC. He said, then we don't want you. So I said, why do you want me as director? And amazingly, what he said was, we want you to bring something of Christian Medical College to this institution. And you can do that only if you're at the helm of affairs as director. So if you want to join us, you join us as director and nothing else. So for a person in the industry to recognize this value in a Christian institution was totally amazing for me. Now, if we look at healthcare-based, faith-based healthcare in India, this is data from 2021. You can see that this is the CMI, and I don't have to tell you, 270 member institutions, 9,000 health professionals, and all the rest. And you can see that it's scattered all over India. This is the Emmanuel Hospital Association. I couldn't get data on the numbers, but you can see that their work is focused mainly in North India. And this is the Catholic Healthcare Association, and you can see that there are 70,000 beds. I didn't realize that it was so large. With 3,500 clinical establishments, 21 million patients, amazing numbers to see what Catholic institutions are doing in India. Can there be any doubt about the relevance of the Christian mission in India in 2023? But as we look at our mission hospitals and wonder why many of them are closing, we need to look at whether they are addressing the challenges of governance, of financing, of service delivery and human resources. I believe where we don't do this using all the wisdom that God has provided us, we will not succeed in our mission to remain relevant in the India of 2023. This is the Ranipet campus of the Christian Medical College, and I believe that our tertiary level institutions must be the best that there is in the country. If we are not better in terms of competence, in terms of infrastructure, in terms of compassion, then we will lose out to the healthcare industry, which is coming up in a big way in India. Our secondary level institutions, and an example of an institution which is surviving and thriving and growing, is the Christian Fellowship Hospital in Odinchhatram. I picked this one up mainly because I worked there for 2 years and I could understand what it was to make an institution survive, and what it has done is remarkable. But we also have a space in community health, and this is exemplified by the Comprehensive Rural Health Project in Jamkhed, which looks at all aspects, because health is only an endpoint of education, of nutrition, of sanitation, of family planning. Health cannot be seen in isolation, and if rural incomes are not increased, health cannot increase. This is my own classmate, Dr. Nandakumar Menon, and his wife Shaila, and what they've done in the tribal population of Gudalur is absolutely amazing. So it is possible in the community health space for Christian institutions to be an example. Now, this is the new campus of CMC in Chittoor. Now, we want to start a new medical school there. I believe that we have to think out of the box. We don't need to produce another 100 doctors in the 100,000 that are being produced every year. We need to think out of the box. And I believe what should be done in the Chittoor campus is to develop an absolutely new program of an MBA in rural health management. A doctor cannot be expected to have competence in pediatrics, in OG, in medicine, and at the same time look at incomes of agriculture, sanitation, working in rural communities. And I believe this would be a unique contribution to India if we can do this. Now, one of the things I believe that we need to imbibe from our master is the concept of servant leadership. And this is a book which is written by two authors in the BMJ, and it says one style of leadership that is inherently compassionate and other-oriented is servant leadership. And Jesus taught us that this is the way we must lead. I want to quote with a quote from somebody from All India Institute of Medical Sciences. So we must never ever believe that compassion and caring and competence is confined to our Christian mission. It is there everywhere, but we must have it more than anywhere. India's medical professions should realize that beyond the lures of pharmaceutical industry and tons of capital lies an unexplored horizon of hope. To evolve as social physicians of Bore, along with the science of healing, we need to learn the art of compassion. In the words of Hippocrates, the father of medicine, wherever the art of medicine is loved, there is also a love of humanity. So in conclusion, I believe that yes, there is a place for the Christian mission more than ever in the India of 2023, where value systems are breaking down. Thank you very much.